The chair now recognizes the gentleman from Connecticut, Mr. Courtney, for 5 minutes.
Thank you, Madam Speaker. And this morning, I wanted to share with the chamber the latest statistics from the Center for Disease Control and the Department of Health and Human Services regarding infection rates and vaccination rates in the country. And I'm proud to say from the state of Connecticut, which the Speaker knows well, we ranked as the lowest infection rate in the country, 1.4%, 14 cases per 100,000. Simultaneous with that report was the numbers regarding vaccination rates. And for population 18 and over, we are at 80% vaccination rate, which again is the highest in the country. It is blindingly obvious there is a causal connection between communities that come together to boost vaccination rates and the benefit and the result of reducing infection rates. And the benefit in terms of our hospital system in the state of Connecticut, again, we have some of the lowest 9 per 100,000 COVID patients, which again ranks number 3 in the country, right behind Vermont in the state of Massachusetts, who are 7 per 100 and 8 per 100,000. What does that mean? It means there's no pressure on your ICU units. There's allows for normal elective surgeries and the processes of hospitals to continue, which is the end game of what we all should be focused on like a laser, which is to get this beyond this pandemic. It didn't happen by itself. Anecdotally, in my district, I was over at the Coast Guard Academy the other day, 99% vaccination rate with the student body at the Coast Guard Academy. These are the future leaders of our coastal sea service, and they get it. They understand the benefit so that they can attend class and have a normal campus life. Across the river, the submarine base in Groton, again, just shy of 90% vaccination rate. That's 10,000 sailors and officers. These are people with families. These are folks who, have pregnant spouses. But they get it. I mean, there is no way you can socially distance in a submarine. And they, again, are now the #1 naval installation in America in terms of vaccination rates. Again, it did not happen by itself. Governor Lamont, back in the spring of 2020, basically tuned out all the noise. He brought together experts from the Yale School of Public Health. He brought together experts from Hartford Healthcare Hospital System, which, again, is the largest hospital system. They brought together the community health centers. They brought together community groups and, again, stayed focused in terms of getting testing, masking, and vaccinations out there to the public at large. I would note, Madam Speaker, that when we passed the American Rescue Plan back in March, like every state, we were given an allocation to our public health system for communication and education. And again, it has been put to good use, obviously, as these numbers show this morning. On Tuesday, the Biden administration announced the release of funding for community health centers, which again have been the backbone in terms of reaching hard-to-get populations to get the help that they need during this pandemic. And again, in Eastern Connecticut, the 2 community health systems, the United Children and Family Services and Generations, again, are getting close to $1 million for new equipment and new infrastructure to, again, carry out their mission to, again, make sure that we are going to beat this virus once and for all. All the issues that we talk about here, and they're all so important, right now we still cannot be distracted from the need to get on the other side of this pandemic. And as these numbers today show from my state, is that when you work together, when you just combat all the misinformation and bad stuff that's out there about vaccines and masking. We had a hearing in Hartford where they had people up there saying that the authorization from the FDA was only for the German vaccine, not the American Pfizer vaccine, which is ridiculous. But that stuff's out there, but we've overcome that. And again, the numbers, again, they speak for themselves in terms of that success. And I, again, look forward to working with my colleagues to make sure that, again, we keep this priority number 1, 2, and 3, because that's how we recover our economy, and that's how we recover a normal life in this country. So let's work together. With that, I yield back.